In today's Health Watch, if you're from Wisconsin, chances are you or somebody you know might have grown up in a rural community. And these communities are often where doctors are needed the most.
Local 5's Caitlin Corbett tells us how Aurora BayCare Medical Center is helping train student physicians in rural medicine.
Expanding access to quality health care in rural communities is part of the goal of the Wisconsin Academy for Rural Medicine, or WARM. Thanks to Project WARM, students studying medicine at UW-Madison can get the training they need at Aurora BayCare to practice in the areas that need it most.
I'm from a rural community just south of Green Bay, actually, in Reedsville, Wisconsin. So I grew up on a hobby farm. Once I realized I wanted to practice medicine, I knew that I would want to come back and work in a rural community.
And thanks to the Wisconsin Academy for Rural Medicine's training program within UW-Madison, med students like Marie Wedipol can train for exactly that. Aurora BayCare is one of 3 campuses throughout the state that helps with that training.
There's a disproportionate number of physicians in Wisconsin in the major cities for a lot of good reasons, but the rural areas need more physicians, and this is UW's attempt to correct that distribution problem. Many of the communities around Green Bay, up to 100 miles around Green Bay, and especially going north, they have a physician shortage. And Aurora BayCare is well positioned on this side of the state to help train those students that may want to come back to this area once they finish their training after medical school.
The program trains the students in things like wilderness medicine, where resources are limited for providing aid. And these students don't have to compete with residents or fellows to get firsthand experience like they would in a major city hospital.
1, 2, 3.
And the idea for the program appears to be working. Around half of Project WARM's graduates go on to practice in rural communities, something Wedipol hopes that they can convince even more people to do.
Not only is it important to recruit people who are from rural areas who want to come back to those rural areas, programs like this, even if you're not from a rural area and want to practice in a rural area, it can show people the benefits of a lifestyle of living there, to just get them the experience they need so that they are willing to come to those communities and work there.
Learn more about Project WARM by visiting Aurora BayCare's website. And that's your Health Watch. For Local 5 News, I'm Caitlin Corbett.